everyone. Thanks for joining us. We'll get started in a couple of minutes at the top of the hour. Hello, everyone. If you just joined us, we're going to get started in about 1 minute at the top of the hour. Hi, everyone. Welcome to today's webinar, Transportation Planning Innovations and Health, how MPOs are combining core skills and creativity to advance health. My name is Michelle Lieberman. I'm the Senior Technical Assistance Manager at the Safe Routes Partnership, and I will be your webinar moderator today. Today we're going to hear from 3 MPOs, the Delaware Valley Regional Planning Commission, the Southern California Association of Governments, and the Northeast Ohio area-wide coordinating agency, and they're going to tell us about their agencies and how they're supporting health and equity through studies, task forces, and programs that serve their communities. Before we get started, a little bit about the Safe Routes Partnership. We're a national nonprofit organization working to advance safe walking and biking to and from schools, improving the health and well-being of kids of all races, income levels, and abilities, and fostering the creation of healthy communities for everyone. A little bit about how we do this. We're working to improve the quality of life for kids, families, and communities. We advance policy change at the federal, state, regional, and local levels. We catalyze support for safe, healthy, active communities, and we share our deep expertise as we learn from the field. A little bit of webinar housekeeping. On the left is the GoToWebinar viewer, through which you'll see the presentation. On the right is the GoToWebinar control panel. Here you can raise your hand, ask questions, and select the audio mode you'll use. Please note your control panel will collapse automatically when not in use. If you want to keep it open, you can click the View menu and uncheck Auto Hide Control Panel. There are 2 options for listening to us today. You can use your phone or your mic and speakers. If you're having a sound problem with one selection, try the other option, and we'll do our best to field any issues if you send us a chat message. Even though you're muted today, we want to hear your input and questions. You can use the questions box to ask speakers questions for the Q&A portion of the webinar, which will take place after all of the speakers have presented, and we'll try to get to as many as possible in the time that we have. So after viewing today's presentation, if you want to view it again or send the link to your colleagues, you can do this by going to our website, saferoutespartnership.org. If you click on the Resources tab heading and click on the webinars in the list on the left side of the page, all of our past webinars are stored here for your viewing pleasure. And they're really great resources, so I urge you to take a look at these. So in addition to this webinar, we've just released 2 new publications on MPOs and health. You can find these on our website. The first one, MPOs and Health 101, covers the nuts and bolts of regional transportation agencies. And the second one, MPOs and Health 201, covers best practices and promising opportunities for MPOs to support health. We also had a webinar last week that covered how MPOs are supporting health and equity through their regional transportation plans and other core responsibilities as an MPO. You can view the recording of that webinar on our websites. So now for our speakers today, I will share their bios before their presentations, but to give you a quick run through of our agenda, we're going to have Sarah Zimmerman from the Safe Routes Partnership give us an overview of MPOs, what they are and what they do. We're going to hear from Marco Giorgini at the Delaware Valley Regional Transportation Commission, Kate Menning from the Northeast Ohio Area-Wide Coordinating Agency, and Anita L from the Southern California Association of Governments. So we'll start with Sarah. Sarah serves as the Program and Policy Director for the Safe Routes Partnership. In this role, she works to support communities in obtaining resources and advice they need to increase physical activity and safe walking and biking for children and adults. She oversees the work of the Program and Policy Department in providing high-quality assistance and advice to communities across the country.
Hello, everybody. Michelle, is my correct screen showing now?
Yes, it is.
Terrific. Well, great. Hi, everybody. I am Sarah Zimmerman. I'm the Program and Policy Director at Safe Routes Partnership, as Michelle mentioned. And I am really delighted today to provide a very quick introduction to metropolitan planning organizations, which I will call MPOs. So I'm going to talk about what they are and also why they matter for health, for equity, for active transportation, and for safe routes to school. One of the kind of biggest lessons that we learned from developing the reports that Michelle mentioned is that MPOs really are one of the most important kinds of agencies that nobody has ever heard of. So we are really hoping that this webinar and also its companion webinar from last week are going to help clarify what MPOs are, help people understand why they matter, have an exposure to some of the really great things that many MPOs are doing, and also give public health and active transportation advocates a little bit better sense of how to work with MPOs so that we can jointly help our regions develop into healthy, walkable, sustainable, and vibrant places. So what is a metropolitan planning organization? MPOs are regional planning agencies for metropolitan cities, their surrounding urbanized areas, and also contiguous areas that are expected to become urbanized in the next 20 years. These are agencies that are required by federal law. They're actually established by the states themselves, by state governments or the governor, and they're operated by local decision makers. So that structure means that they're inherently involving a really complex mix of stakeholders. And kind of a complex situation there. They're required for any urbanized area that has a population of over 50,000 people. So that means an MPO's region can be smaller than a county, or it can encompass many, many counties. And there are over 400 MPOs across the United States. And each MPO plays a really essential role, not just in planning for its region's future and making decisions and developing plans, but also in making decisions about how transportation funds will be invested to achieve those plans. So how do MPOs work? Each MPO is governed by a policy board. So that policy board is usually composed of elected and appointed officials from the cities and the towns and the counties and public transportation providers that are in that region. However, the policy boards for MPOs in different places have very different structures, different membership compositions, and different voting allocations. So the balance of power and how decisions get made in different MPOs can be quite different from one MPO to another. But for all MPOs, the goal is really to coordinate planning among all those different actors across the region so that you don't have one city with one set of goals and another with a completely different set of goals that are abutting each other, but that they're coordinating and working together. Another important thing to know about how MPOs function is that they almost always have a variety of different advisory committees. So they almost always have what are called technical advisory committees, or TACs, that are made up of transportation engineers and planners from local jurisdictions who are really bringing technical expertise to some of that decision making. And they may also have a wide array of other kinds of advisory committees. So there often may be bicycle pedestrian advisory committees, that may be known as BPACs. There can be citizen advisory committees that are specific channels for your average citizen to have some input, and so on. So why do MPOs matter? More than 70% of the people in the United States live in the urban areas that are within the jurisdiction of MPOs. And that is true even though the land area that is within those MPO boundaries is only about 5% of U.S. land area. So the significance of that is that MPOs are guiding these decisions that affect the majority of our population here in this country. And they're also making really important decisions about transportation and land use and access in the areas that are really our economic powerhouses. As we've discussed, MPO planning and actions really have an enormous impact on transportation and how transportation works within a region. And as we also know, transportation has a really deep effect on health. So that means that MPO decisions end up having a really strong influence on things like whether we can get physical activity by walking and biking to our everyday destinations. And that, of course, affects our likelihood of developing a wide array of different kinds of chronic disease. They also affect our likelihood of death or serious injury due to traffic collisions, which kill tens of thousands of people each year. They affect whether there's poor air quality in our regions. That means that our kids develop asthma, that we develop lung cancer or diabetes, or that we experience miscarriages. They also affect whether we can reduce transportation's contributions to climate change and minimize the public health consequences of climate change. They affect how equitably or inequitably the health burdens and benefits of our transportation system are distributed, and many, many more things. So how do they do that? What do MPOs actually do? The core duty of MPOs is to engage in short and long-term planning that in large part controls which substantial transportation projects do and do not move forward in a region and how federal and state transportation funding gets spent. So MPOs engage in more or less continuous long-term planning. They are pretty much all the time at some point in their cycle of developing documents that are known as long-range transportation plans. And those also go by other names that are used in different areas: regional transportation plans, metropolitan transportation plans. Different MPOs call them different things. But those plans set out goals and objectives, and then they also select specific projects that they see as helping to achieve the goals that are set out in that plan. MPOs also develop short-term lists that are known as transportation improvement programs, or TIPs, and these select projects for funding in the next 4 years. The projects that are selected that are in a TIP must be either listed in or consistent with that long-term plan. So that means that all of this planning that goes on is not just important because, of course, we want to coordinate and we want to think through what we want the future to look like in our communities, but it also has a very controlling impact on what actually gets built. So what else do MPOs do? They do so many more things. They engage in a wide array of additional activities, and some of these are required by federal law or by state law, whereas others are voluntary activities that an MPO may select in order to advance specific goals that it has, like health, like physical activity, like economic opportunity for the region. So what are some of these additional things they do? MPOs may have funding that they control themselves, and they may award that funding. That may be a specific thing that they do. They engage in congestion management planning and related actions. They conduct required public engagement and have detailed plans and actions around that. They provide technical assistance, trainings, and model policies to the local jurisdictions that are within their boundaries. They coordinate stakeholders within their regions, and many, many more things. So with that really lightning overview of MPOs and what they do, we are now going to hear from our friends at several MPOs about some of the great things that they are doing to support healthy and thriving communities.
Thanks, Sarah. Okay, we're going to transition over to Marco. Marco is a transportation planner in the Office of Safe Streets for the Delaware Valley Regional Planning Commission in Philadelphia, Pennsylvania. Marco focuses on traffic cache analysis, coordinating the Regional Safety Task Force, and assisting the member governments with transportation safety-related planning initiatives. He's particularly interested in supporting the implementation of Complete Streets and Vision Zero policies throughout the region. He received his BA from Vassar College and his Master of Urban Planning from Harvard University. Take it away, Marco.
Great. Thank you. Good afternoon, everyone. Thank you to the Safe Routes Partnership for inviting me to join this. Today I'm going to present some findings from our project, Crashes in Communities of Concern in the Greater Philadelphia region. So just to dive right in, DVRPC, as was mentioned, is the MPO for the Philadelphia region. We're a bi-state agency. We cover counties both in Pennsylvania as well as in New Jersey. And as a recipient of federal funding, DVRPC is subject to civil rights and environmental justice directives, which include Title VI, and that directs that the benefits and burdens of transportation infrastructure must be fairly distributed. So before I dive into to our research, I want to just go over a few key terms that I'll be mentioning. One is KSI. Those are killed in severe injury crashes, and those are the most serious crashes on the road. Vulnerable users, in this case, I'm referring to non-motorized road users, so bicyclists and pedestrians. We're also talking a lot about communities of concern. So this is a definition from the Plan Bay Area 2040 document, and it's one way of looking at communities of concern. As I go through the presentation, I'll narrow down a little bit to what we're referring to specifically with this project. And then lastly, indicators of potential disadvantage, or IPDs, are an equity analysis tool that was developed by DVRPC. So in putting together this project, we were trying to answer a sort of central research question. This question of, do communities of concern in our region experience severe traffic crashes disproportionately? And if so, which populations are at the greatest risk? And in addition, where in our region is the impact most critical? And in doing our literature review, we came across this work of Dr. Thomas Leviste, which particularly resonated with us. He makes the argument that race determines place, which in turn determines health. And what he's saying is that if you look at things like the history of redlining and other practices of institutional racism, that's resulted in segregated cities and regions, and that has resulted in vastly different health outcomes for people that live just a few miles away from each other. So we use that framework to understand traffic safety as a public health issue and to guide the lines of inquiry for this project. So to begin, we started with DVRPC's indicators of potential disadvantage, our equity measure that we use as a tool in our Title VI compliance efforts. So the way this tool works, we use U.S. Census data to assign a score to each census tract in the 9-county region, and that's based on the proportion of the population that falls into each of the 9 categories that are listed on the right. Those categories correspond to federally protected classes under Title VI, as well as groups that are identified by the Environmental Justice Executive Order. The scores for each of those 9 indicators is then summed, and we create a composite score for each census tract, which I will refer to as the combined IPD score. And this map is showing us what that combined IPD score is for each census tract in the region. Census tracts that are lighter green have a lower combined IPD score, so fewer of those populations, whereas blue ones have a higher combined IPD score. And just keep in mind where those blue areas are, because I'm going to refer back to them in a moment. So we used a similar process to assign crash rates by census tract as well. We created a combined crash rate that's based on the rate of KSI, or again, those killed and severe injury crashes, and that was matched with a vulnerable user KSI crash. So on this map, lighter yellow census tracts have a lower combined crash rate, while the darker red ones have the higher combined crash rate. And by comparing this map to the previous map of the combined IPD score, we can see that there's some evidence of a relationship between the combined IPD score of a census tract and its combined crash rate. Many of the sort of darker red areas on the crash map also appear to be darker blue on the IPD map. But to take this a step further, we conducted a correlation analysis to determine the relationship between the IPDs and the crash rates in a statistically defensible manner. So we tested the relationship of the 2 crash rates, which are listed on the top of the chart here, against each of the 9 IPDs individually and to the combined IPD score, which is, those are all listed on the left side of the chart. So we based this on a minimum R value of 0.3 to determine whether there was a correlation, and we found that 4 IPDs correlated with at least one of the 2 crash rates: low income, racial minority, ethnic minority, and disabled populations. We also found that the combined IPD score correlated. So to put that in a sort of less jargony way, what we're seeing is that in the DVRPC region, just 43% of the census tracts region-wide are above average for at least one of those 4 correlated IPDs. But 91% of census tracts where crash rates are above average are also above average for at least one of those correlated IPDs. So in other words, the places in the region where the crash rates are highest are overwhelmingly communities of concern. Our analysis found that areas where 4 protected classes live, low income, racial minority, ethnic minority, and disabled populations, people there bear the brunt of traffic violence in the region. So to explore this more deeply, we decided to do a case study analysis, and we chose census tracts across the region, but I'm going to look at one in particular. This is Fairhill, which is a neighborhood in North Philadelphia, and it's bordered by 5th Street to the west, by railroad tracks that you can see to the north, and then along the south is Lehigh Avenue, which is a major east-west arterial in the city. Fairhill has one of the highest crash rates in the region, particularly hit pedestrian crashes, which are shown as red dots on this map. And these are all, I should note, also KSI hit pedestrian crashes. So these are hit pedestrians that resulted in a fatality or a serious injury. This census tract is also above average for all 4 of the correlated IPDs, again, low income, racial minority, ethnic minority, and disabled. And this census tract, and Lehigh Avenue in particular, had many of the characteristics that we found across the case study census tracts, including these wide arterial roadways that carry fast-moving traffic through community-serving land uses like commercial parcels and adjacent to residential areas that have high rates of pedestrian activity. And we used the rate of 0 vehicle households as a sort of proxy for that pedestrian activity. So we did a field visit to Fairhill, and these slides just show some of the issues that we found, like the long crossings and faded lane markings, as well as dangerous driver behaviors, like this car kind of blocking the sidewalk, and all these things combining to create a clearly treacherous environment for pedestrians. What we found is that in these census tracts, infrastructure changes could calm traffic and make what might be a potentially dangerous choice have a less severe outcome. So our case study, again, analysis, what we identified were these wide roads with fast-moving traffic near residential areas where people are less likely to drive as the key issue in addressing disproportionately high severe traffic crashes in communities of concern. We identified 2 primary recommendations to address this. One is to consider systemic safety measures to slow traffic in communities of concern, and that's particularly for the roadway owners in our region to think more about where we could install more low-cost traffic calming. But the second one is the one I want to focus on more, and that is to prioritize safety investments that benefit communities of concern that have these traffic safety challenges. And so what we mean by that is to really try to target safety investments to these correlated communities of concern through strategies like score multipliers that can try to drive more money to these communities. So I want to just look quickly at 2 programs. One is Vision Zero Philadelphia, and the other is our Transportation Improvement Program, as Sarah was describing. So the Vision Zero Philadelphia, it's not a program of ours, although we support it. It's run by the city, and it seeks to eliminate traffic fatalities by 2030. And what we're looking at here are the scores that were received for neighborhoods applying to its pilot slow zone program. And the 2 on the far left were the 2 programs that were awarded the funds for this program. And you can see in the blue the scores that those neighborhoods received for their crash experience. In the yellow, though, is the scores that those neighborhoods received for their communities of concern. And what that sort of shows is how heavily the city was weighing communities of concern in determining which program or which neighborhoods would receive this funding. And then the second program, this is DVRPC's TIP, and DVRPC administers the Transportation Improvement Program, and we work with our partners to set project benefit evaluation criteria. So every project that could potentially be part of the TIP is going to go through this evaluation process. In the most recent update to that criteria, recommendations from the Crashes in Communities of Concern report were implemented that resulted in projects located in census tracts identified through this analysis receiving a significant bonus if there was a safety benefit to that neighborhood. And safety in general, as you can see from this chart, rose to the top. It was formerly, I believe, the 3rd or 4th highest. But there's just been a more and more focus on safety as being particularly critical for TIP projects in our region. So to sum up, we hope that the methodology we devised for this project can be used as a framework for other regional decision makers in their efforts to address places with the greatest risk of severe crashes, and also to begin to alleviate a critical area of disparate health impacts to communities of concern. Thank you, and please feel free to contact me. I put my contact information up here on the screen.
Great, thank you, Marco. Just as a reminder, if you have questions, we'll probably have a little bit of time for Q&A at the end. If you have questions, go ahead and put them in the questions box as well. Next, we're going to hear from Kate. Kate is a planner with the Northeast Ohio Area-Wide Coordinating Agency, also known as NOACA. This is the MPO serving the greater Cleveland area and surrounding region in Ohio. Since starting with NOACA less than 2 years ago, she was tasked with implementing a Safe Routes to School assistance program for schools and communities within the region, and to assist with implementing the SAVE NOACA's plan for transportation safety. Her experiences as an Ohio advocacy organizer and field services manager with the Safe Routes to School National Partnership, and as a Safe Routes coordinator for the city of Gahanna, provided her with over 12 years of experience, a depth of knowledge, and passion for active transportation safety and Safe Routes to School. Go ahead, Kate.
Oh, thank you. Thanks for that great introduction. Yeah, I wanted to just start by saying that NOACA is the Transportation and Environmental Planning Agency representing the greater Cleveland area, including Cuyahoga County, Lake, Geauga, Medina, and Lorain County. So you can see that really nicely in this in our logo. I want to just give you a little overview about our regional approach. We try to take into account the organic collective connections that are within and between all of our jurisdictions, including our districts, the sectors that we serve and that are within our communities, and then the populations within those communities as well, to improve safety for all and help better connect everyone in our region. So we work through our regional planning approach includes that connectivity, understanding of our local environment, having a robust data and planning support that we can then assist local communities with, that deep transportation planning experience, as well as links to state and federal support. And Sarah did a great job. I learned a lot about how MPOs are structured, and I'm very grateful for that introduction. I also wanted to, there we go. Okay, so NOACA's structure within our organization, my role within this organization is housed in the planning division of NOACA, which is responsible for all that transportation and environmental planning, which includes transportation asset management and safety and traffic studies that we conduct. We provide technical support and data to local stakeholders, project sponsors, as well as the general public. The unit that I am in is the Safety and Operations Unit, and we support the Regional Safety Program, of which is guided by our recently developed SAVE plan, which is up there on the screen. This plan is for transportation safety in our region and is intended to be an overarching plan to support and identify critical safety focus areas that are needed for improvement. And it complements the Ohio Strategic Highway Safety Plan and the performance measures that were adopted to meet the requirements for the FAST Act. So strategies and actions within this plan we've recommended are considering what things NOACA and its partners can do to reduce fatal and serious injury crashes. So you'll see on a couple of other slides too the term FSI, and that's our KSI, which is fatal and serious injuries. So this slide really shows, this is a graph within the SAVE plan. Within our plan, we have identified 10 emphasis areas that you're going to see. They're written out there on the left-hand side. This provides the focus for our work, and these were identified through crash data analysis and other analyses in developing our plan. So this table shows a breakdown by maintenance responsibility of local versus state jurisdictions, roadways, and then within each of those 10 emphasis areas. And I find this very revealing because as indicated by the heat coloring, which is red is the worst and light blue is the best, local and specifically municipal roads account for the highest percentage of fatal and serious injuries in our region. And of those, bicycle, pedestrian, and intersection emphasis areas are the highest. And you can see those represented in the red. The bicycle, for example, 97% of those happen on local roadways. 88% of those roadways are in municipalities. Pretty much the same with pedestrians. 92% are on local versus state roadways. And of those types of local roads, 89% of those are municipalities. So we see pedestrian and bicycle emphasis areas as being vulnerable areas, emphasis areas, and populations within our community that need to be addressed. And intersections also count in that as well, because intersections have a high number of traffic volume, and these are areas of where most vulnerable populations are going to experience crashes. So when we were developing the SAVE plan and then some programs that I'm going to tell you about in just a minute, we asked ourselves, how can we affect change on these locally owned roadways? How can we assist our local communities with developing, developing roadways that are safer? Also, how do we change behaviors that lead to these crashes? Behavior change is particularly challenging for us since our role as MPO and a regional planning organization, we function through planning and engineering and data collection and analysis. So we need to seek partners and collaborators that are needed to address these behavior changes, or organizations and groups that are already working in these environments. Finally, we want to also improve safety, equity, and quality of life throughout our region. So again, we want to develop programs and resources that build on our strengths as an MPO and the skill sets that we have here, and then complement those with, have complementary partners that also have complementary strengths, and so that we can achieve common goals within our communities. This is where we have found that health in particular is a great partner in our local communities. Health partners are a natural match because we have many common policy, system, and environmental change goals that overlap within our directives. Obvious areas of those overlaps include safety, safety for all people, but for vulnerable populations as well, injury prevention, particularly with children, community planning and development, and then policy adoption that supports safety. So I'm going to highlight two programs that we have started developing, or we are working with partners in our community, where we're using our strengths as an MPO to assist local communities and partner in a lot of health arenas and using their strengths in order to, just ramp up our importance and our impact within our communities. So the first program that I have been tasked with to design here is NOACA's Safe Routes to School Assistance Program. This is really a nexus between transportation, safety, education, health, and equity. And this program is a framework that is based on the 6 E's of safety, with a goal to increase safety for students and families walking and biking to school, which in turn supports those health goals of supporting physical activity and improving healthy lifestyles within our communities. We look at Safe Routes to School through the lens of environmental justice areas, Ohio Department of Education school report card data, attendance indicators within those report cards, and crash data, which is also considered when we're looking at our communities and the support that they need. This particular program directly supports our pedestrian, bicycle, intersection, and young driver emphasis areas. So hits a lot of different marks within our safety planning directives as well. One component of our Safe Routes to School assistance is in school travel plan development. These are foundation plans for communities and schools to address student transportation safety, infrastructure and non-infrastructure issues, and to document actions that can improve student safety as a whole. The Ohio Department of Transportation in our state requires an approved STP to apply for further state-level funding for Safe Routes to School funding, and MPO support is necessary for those applications. So as part of our assistance program for school travel plan development, we can assist through serving on their development teams, providing or assisting with developing proximity and crash data maps. Proximity maps are the distance between the school and the student population within those areas, and there's a map there on the left-hand side that's an example. We can assist with walk and bike audits, priority corridor identification, assisting in that public input process and public input facilitation, and also integrating Safe Routes to School elements into school siting processes, which is a whole different topic that is very near and dear to my heart, and would love to talk about more. But just know that, you know, the location of your school directly affects how students are going to get there. And that's one of the things we'd like schools to consider when they are siting or renovating their school. The second element in our assistance program is actually the implementation of these school travel plans. So communities develop plans, but they also need to implement these plans in order to create those safer environments. So we can provide assistance not only through sitting on teams and committees that are doing that implementation, but providing funding application letters of support not only for ODOT Safe Routes to School funding, but for other funding streams, that GIS and mapping assistance that we can also provide at the development level, pedestrian and cycling crash data, infrastructure locations, and then school pool and street supplies programs are programs that are unique to our MPO area. School pool is a NOACA-based service that is run through Ohio Commute, which is a larger statewide program. This online platform helps connect families who want to share school commutes, either by car, by foot, or by bike. And it assists schools in themselves with alleviating vehicular congestion and improving air quality around their facilities. Street Supplies is a NOACA lending library of equipment and materials to temporarily try types of transportation infrastructure changes in real time. So jurisdictions in Northeast Ohio can gather meaningful public input on proposed designs, evaluate the potential benefits of a transportation project before its permanent construction, and then enliven public spaces while improving safety for all modes. And then we also do administer the Northeast Ohio Safe Routes to School Forum, and we encourage participation in this forum to share information and related ideas between communities and Safe Routes to School practitioners. The second major program that we're currently working on is actually as a partner on a child injury prevention program. Cleveland's University Hospital applied for and received funding for a childhood injury prevention program. It was through a grant from the Ohio Department of Health, our Office of Health Improvement and Wellness, Violence and Injury Prevention Program. University Hospital was only one of 6 chosen statewide to receive these funds. And we were approached as a partner during the application process to support their grant application and then serve as a partner and collaborator on the project through planning and implementation support, leader engagement, and community participation. So the funding is renewable for 5 years, and this project works to support SAVE plan emphasis areas in the bicycle, pedestrian, young driver, and intersection emphasis areas. Just a quick look at their PSE, or Policy Systems and Environmental Change actions. These actions are directly addressed in their program and in their grant application and the program. So you can see the amount of overlap with transportation safety that is occurring in this health-driven program and grant funding. So this is just another way that a health project is truly affecting and supporting transportation safety. And just to let you know, GDL stands for Graduated Driver's License. Sometimes there's a question about that. That is the terms and rules that are restrictions by the Ohio Bureau of Motor Vehicles for drivers that are under the age of 18. So two of the things that we have done in to directly assist at the early stages of this program is really through data analysis. So we wanted to help University Hospital to best identify areas of highest need and impact for their programs. So the first thing we did was identify high need areas for youth bicycle education, because that was one of those PSE factors that they're working on. So what we did is looked at fatal and serious injury crashes in Cuyahoga County that involved bicyclists and pedestrians ages 18 or younger. And we actually did two maps because it was kind of easier. We have the map on the left, which shows the actual locations of those fatal and serious injuries by community. But our map on the right actually shows, it's more like a heat map where you show concentrations of crashes in particular areas that help University Hospital and helps this program target or locate areas where there are highest needs and concerns. So the second area of need that they needed information on was for teen drivers. And so we did another data analysis map here, identifying high need areas for teen driver education that really addresses crashes, those injury and fatal crashes that occurred with drivers that were 16 and 17 years old. And then again, you can see on this map that there are higher concentrations, there are groupings of those crashes. And this is really helping the program be able to focus effectively, not only on areas of high need from a crash standpoint, but overlaying this data with equity issues, environmental justice areas, for example, or communities that have high populations of walkers and bikers, or low populations of drivers, can help assist in them being able to target their programs most effectively. So I left this slide in. If you would like to learn more, there's a couple of sessions at the Safe Routes to School National Conference coming up in the next month. I'm going to be expanding on these topics, but we've got a lot of great other panelists that are going to be talking about technology and data collection and analysis for Safe Routes to School programs, and then how transportation safety and air quality is addressed through regional Safe Routes to School assistance as well. So I hope to see you there, encourage you to come. Thank you.
Thanks, Kate. All right, our last presenter today is Anita L. Anita is an Associate Regional Planner at the Southern California Association of Governments, otherwise known as SCAG, and she specializes in environmental justice and the California Environmental Quality Act. Prior to joining SCAG, she worked as a consultant for MIG, Hogle, Ireland, and she earned her bachelor's in urban studies and master's in urban and regional planning from the University of California at Irvine. She's worked with a variety of organizations in environmental planning, including Caltrans District 12, SCAG, the Orange County Transportation Authority, and the City of Irvine.
Thank you. So my name is Anita L, and I'm here to talk about environmental justice at SCAG, and that includes our EJ program as well as a lot of other projects. So just a brief intro on what SCAG is. Thank you, Sarah, for presenting on what MPOs are. SCAG is an MPO, but we were founded in 1965 as a joint powers authority, which means that we're established as an association of local governments and agencies that voluntarily convene as a forum to address regional issues. And under federal law, we're an MPO, and under state law, we are a regional transportation planning agency and a council of governments. And our SCAG region is actually quite large. We are the largest MPO in the nation. We're governed by a regional council of 84 elected officials, so that's a very, very large board. And we're also the nation's global gateway for trade with 1.2 trillion regional GDP. We have 40% of the nation's container imports, and we have 19 million people in the area. So it's just a very, very large area to plan for. And as an MPO, we are tasked with developing a regional transportation plan and sustainable community strategy every 4 years to plan for a 20+ horizon year for the region. But because we are doing the regional transportation plan, we have some regulations that we have to adhere to for environmental justice aspects. So because we do receive government funding, we are required to do analysis on environmental justice for our regional transportation plan, and we have to disclose benefits and burdens of the proposed project, which is our RTP-SES on minority populations, and then we have to ensure that our RTP-SES does not deny benefits or discriminate against specific populations. So for SCAG's Environmental Justice Program, we have 3 policies, which are identify areas with disproportionately high and adverse impacts on minority and or low-income populations and consider alternative approaches and propose mitigation for the SCAG region when needed, to continue to evaluate and respond to environmental justice issues that arise during and after the implementation of SCAG's regional plans, and do analyze disproportionate impacts and identify potential solutions to incorporate into our long-range transportation plan. So in a regional transportation context, we want to ensure that low-income and minority populations have adequate opportunities to participate in the decision-making process, and that to identify whether such communities receive an equitable distribution of benefits and not disproportionate share of burdens. So we have 3 main elements in our EJ program. Public outreach and technical analysis are 2 very main elements, but then we recently added policy coordination because there's some recent legislation in California that brings EJ to the forefront and requires us to, or not requires us, but requires local jurisdictions to do something about environmental justice. So the products that come out of our EJ program and working with the EJ program within our different departments includes our environmental justice technical report, which we do every 4 years, an environmental justice toolbox, environmental justice working group, and then and our SCAG technical assistance and Go Human program. The last 2 items are not actually part of our EJ program, but these projects and programs are within SCAG, and we coordinate with different departments to get these programs running. So the first is our environmental justice technical report. We have to do an analysis on our regional transportation plan and see how that specifically impacts low-income and minority communities, as well as a lot of other groups that we include, like elderly, youth, households without high school diplomas, households without a car, and whatnot. So we look at a lot of different populations. And our main areas of analysis include 3 areas: environmental justice areas, which have higher concentrations of minority or low-income population. Disadvantaged communities are areas deemed by a state-established tool called CalEnviralScreen to have the most population and impacts based on a very wide range of factors. And communities of concern, which is SCAG developed areas with higher concentrations of minority and low-income populations. So as you can see in the map, those 3 analysis areas covers a majority of our region, so that's why it's such a important issue for us. And we also develop 18 different performance indicators, and we do analysis on these different indicators to see how they're impacted. The plan impacts are the low-income minority populations. And then we also do an environmental justice toolbox. So, because after our analysis, should we find any adverse impacts to specific communities, they can use our toolbox to either help develop policies and strategies, or just as a resource to develop their own specific policies and strategies. We have about 7 different topic areas in our toolbox, and I have 4 different examples here. They're meant to be very broad and just providing an example for local jurisdictions or community-based organizations to help develop their own policies and own strategies. And we also have our environmental justice working group. So originally, we did not have an ongoing environmental justice program. We kickstarted every 4 years specifically for our regional transportation plan to do an analysis. But because EJ is becoming a bigger interest, at least in California and in the nation, we wanted to kickstart to have an ongoing EJ program, so we don't just do outreach every 4 years. So this working group was requested by our stakeholders, and membership includes advocacy groups, local jurisdictions, regional and sub-regional agencies, and academics as well. And so far we have met 6 times. We actually have another meeting today. This will be our 7th meeting. And a lot of the content includes our regional transportation plan and our technical analysis updates, but then we also do a lot of information sharing and invite a lot of our stakeholders to present on projects that they are doing related to EJ to give like good case studies as well as best practices. And we also do technical assistance for our local jurisdictions per a legislation from California called SB 1000, which requires any local jurisdiction with disadvantaged communities to develop an environmental justice element or incorporate environmental justice policies into their general plan. So we develop basically a general plan template with all the data points and maps needed for each of our local jurisdictions, which we have 191 and 6 counties, where it makes it easier for them to update their general plan. It can save them time and money, so they don't have to, or if they hire a consultant or they do in-house, they already have all the data and all the maps needed to do their general plan update. And then we specifically have a section for the environmental justice element. So for the jurisdictions that don't have the resources to do such things, we can help them with that. And then the last item that I wanted to showcase is our Go Human program. We aim to reduce collisions, create safer streets, increase rates of active transportation, reduce greenhouse gases, improve public health, support active ATPs and other active transportation investments, and change the reputation of our region, not being a sprawling region, but being a healthy and active region. So this campaign has 3 primary components. It's an advertising and awareness campaign. It's also a tactical urbanism or temporary safety demonstration project projects, which sometimes is coupled with open space events. And we also have a toolbox of resources available for a variety of audiences, because active transportation safety reaches out to everyone. So here are some pictures as to what the program has been doing. We've been creating like temporary bus loading platforms. We have some protected lane stickers that we can put on the road that's temporary that people can use, and like artistic crosswalks. These are all pictures taken from the events that we've had. So since 2016, we've done 38 demonstration events with at least 5 more in the works right now. Through 3 advertising campaigns, Go Human has achieved nearly 1 billion impressions, which means it's each time an ad is seen or heard. And based on our surveys, about 1 in 5 people recognize the advertising, and most people find the ads to be at least somewhat or very motivating to drive more safely. At the 10 events that we hosted last year, 70% of attendees shared that they had never been to a community meeting about transportation before, and 85% of people supported infrastructure improvements. So we've done a lot related to environmental justice here at SCAG, and we want to continue to grow that through our ongoing EJ program. So with that, I am done with my presentation. If you have any questions, please feel free.
Great, thank you, Anita. We'll open up to questions for the whole audience or all presenters. And if you have questions, feel free to drop them in the question box. We've got a few really good ones come in already, and let me share my screen. So first question is for Marco. On the tip evaluation criteria, could you describe the different shades within some of the bars? And we'll definitely post the presentations for everybody afterwards so they can see it in more detail, but if you could kind of run through what the different shading was.
I can try. It's not my specific area, but what I can say is, so the ones that have different shades include centers in the economy, reliability and congestion, multimodal use. So I think, starting with something like multimodal use, we're trying to show that there's differences between how that score is assigned. So, one area of the shading might be for access to public transportation, while another is to, how many additional maybe miles of like trail access are being added. So that kind of gets to what that is generally about. If you wanted to contact me directly, I could share with you the document where we have sort of like the full breakdown of what everything, is specifically referring to.
Great, thank you. Next question is for Anita. Does SCAG have a specific definition of environmental justice that's being used?
Oh, that's actually a very good question. Currently, we do not, because we're still in the process of making our program an ongoing one. But yeah, sorry, that's all I can say. But that's something that we're working on right now.
Great, thanks. And then also for Anita, on the Go Human pop-ups, any insight you could share on site selection and what has worked with cities and counties on implementing these?
Yeah, so we actually we do advertisements as to what we provide in our Go Human campaign, but then a lot of the requests are coming from jurisdictions themselves that are interested in doing these different pop-up events. So we advertise regionally, but then they're coming to us for it, and a lot of the pop-ups are coming more from, I guess, cities that are a little more equipped with doing these different changes and such, like specifically in LA County and Orange County that have have residents that are more aware of transportation safety and active transportation, and more inclined to use these type of pop-ups.
Hey, Michelle, I could also put a plug in for that street supplies program and answer another service that's provided through street supplies on our website is a guidance piece that actually can help communities walk through utilizing, identifying partners and then utilizing the correct materials in the right way to best, showcase a particular remediation. And in one case, we have used these materials for things like better blocks or public space reforming, so to speak. So the guidance is on the website, and there's a link in the PowerPoint.
Perfect. Great. Two good resources. Actually, a question for both of you. How are your programs funded for these pop-ups and these toolkits?
The street supplies program was initially funded with a grant from the Ohio Department of Transportation for the base supplies and the planning and times we went into actually putting it together. That grant was, I believe, in 2016 or 17. So the program it's in its like second year or third year now of implementation.
And for Go Human, it's actually I think a state-funded transportation grant that we received. It's been going on for about, I think, 3 years now. And unfortunately, I don't know any more details about it because this is from another department, and we somewhat work with them for there's a few demonstrations that they do in disadvantaged communities. But if we are going to have like a Q&A written on the website or something, I can get back to you on that.
Okay, great. Well, we are at the end of our time together. So if you have additional questions, I know there's some that we weren't able to get to, please feel free to follow up with any of our speakers. They've all provided their contact information that you'll see. And if you have additional questions that are more general, feel free to email Sarah or myself. A couple quick things at the end here. There's still time to register for the 2019 Safe Routes to School National Conference coming up in November in Tampa, Florida. Great opportunity to network with Safe Routes to School and active transportation professionals. Really get inspired by a number of the programs around the country. So we hope to see you there. You can go to saferoutesconference.org to register. And finally, before we leave to you today, we will be sending out a quick survey to follow up on the webinar. And we love to hear your feedback. Thank you for joining us today, and thank you to all of our presenters for sharing your programs and your insight with us.